here with Will Eckerd and Monica. We're here with Elevate Miami, and they're going to tell us now their story, which is a great story to listen to. So I hope you like it. Will, I want to ask you how you started Elevate, what motivated you to open up Elevate, and just tell me the story of the beginnings of the company.
Jose, I want to tell you that I actually thank you for taking your time and coming and interview us. It's all about supporting local businesses in a time like this. So Elevate Miami is a wellness company. We specialize in a wide variety of things, but one of the things that we try to focus in on is hormone replacement therapy for men and women. As you know, that's an issue as we get older. So we here at Elevate, we specialize. The company was founded about 2 years ago, and I got with my partner, Lisandro Rodriguez, and we decided to open up a company where we could provide these solutions for these hormone issues that men and women have after a certain age. And that's
since we're getting older, yes, we do need help. That's a great help to the community to give back. Let me ask you a question. When you started the company, like, what was it? Was it just because you were starting to feel a little weak and you wanted to maybe start getting some type of hormonal help? And
absolutely, you hit it on the money. I'm hitting 40 years of age this year. When we started the company, I was 38, 37. I had already kind of, heard about hormone replacement, and I felt it. I knew that this was actually something that men needed to have a good quality of life. We obviously know when we're younger, we have all the energy, all our levels are optimal. As we get older, science takes its toll, and your body changes. So that's kind of where I felt that I could help people, kind of get to those perfect optimal levels. So that's why we came up with the name Elevate. We want to elevate your state of mind, your body, and like I said, we kind of specialize in hormone, but we have a wide variety of products.
Thank you so much for having us and interviewing us. So hormone replacement for me is actually something that became something personal because I was that patient that was having a lot of issues, and I went to different clinics and doctors and found out that they just couldn't nail it on the head. And finally I was able to do some of my own research and seek some medical help, and they assisted me. That drove me to seek to become a provider. And in doing so, specializing in this gap. This is a very large area that is not necessarily taught in medical school or in other provider schools, where people are a little bit scared, and then they kind of just really don't know what they're doing because they haven't really studied it, their mechanism of actions and how things are. And it's not just aging that causes a decrease in hormones. Unfortunately, we live in a Western society that we have very poor diets, very sedentary. We're having issues with vitamin D, not enough sun, not enough physical activity. I was just telling Will the other day, there's a few theories that a couple decades ago, or not even a couple generations ago, men's testosterone levels were actually higher because they were very physical. A lot of hard work were able to stimulate it. Life, medicine, evolution of electronics, and just society and technology has allowed us to have a more sedentary lifestyle, work from home, less physical labor, and the foods obviously are not the most optimal as they used to be. A lot of hormones and GMOs.
The GMOs are affecting.
Sure.
So do you see that a lot? That the
Absolutely.
GMOs. Now I know that they're starting to come out with food that doesn't have the non-GMOs. What do you think of that? Is that something that you would give to one of your patients, that you would tell them, hey, I recommend you start eating this way?
You can, but it's so hard nowadays because a lot of people eat out unless you're like strictly purchasing, and it can get expensive now because organic is so pricey. If you're not cooking at home and just strictly eating at home, you are going to be exposed to some of these foods.
That's interesting, because there's, you do hear a lot of people say, oh, well, I want to get cut up, I want to do this, but they just maybe just go to the GNC and pick up a hormone replacement or whatever. How do you guys test for that? Do you guys do a physical test to make sure that the person has their levels the right way? How does that work?
Absolutely. So we do medical panels, and we monitor them medically. We're not just going to be like gym medicine and just here, take a little bit of this, take a little bit of that. There's definitely a science to it.
Okay.
So we'll make sure we have some baseline labs, and then we'll start you on a treatment that's customized to you, depending on whatever issues that you are having particularly. After a few months, we'll do some further tests. We'll check to make sure your symptoms have resolved and that your levels are back to where they need to be. I have been fortunately enough to be able to use smaller amounts of doses to get maximum amounts of mass. A lot of people think more is better. That's not necessarily so. You can actually injure yourself if you're not medically monitored.
So, as you know, we're kind of a sister company to Family Medical Clinic. So, we intake you as a medical patient.
Okay.
We do full blood work. We make sure that your heart is in the right place. We do an EKG. We do a full overview of your well-being before we do that. So we actually intake you as a medical patient. Once we see that you're okay, then we proceed with the hormone replacement.
Oh, okay, that's
Yeah, and just a little bit more that we also do primary care. So you're not just coming here to strictly as a hormone clinic, and then God for you have hypertension or if you have cholesterol and diabetes, I'll treat that as well. It's not something that, hey, find someone else to fix your problems. No, we'll take care of it all here.
That's great. I had no idea that that's what you guys did, which is great to know. And now it's like a one-stop shop that you can have.
And you'll have your 2 minutes now with Liz, and she'll tell you a little bit more about Family Medical Clinic.
Yeah.
Right now.
Have you tried to do any online?
Absolutely. I can add on that.
Yes,
so we
that
did turn to a lot of telemedicine and direct shipments, as well as contactless pickup, so that we knew ahead of time when you're coming, your stuff was prepared, so it was very minimal contact. And then I spoke to patients directly, face to face, via video, and it was a lot of it. It was actually very comforting to know that, hey, they had some private time with me, we get to talk, and they still had access to their provider. It wasn't like they were lost, now what do I do? So we were able to continue that continuity to the patient.
What is it? What's your name?
Raymond.
Raymond. So you're a chiropractor then?
Yes, I am. 20 years in practice.
Oh, nice. So, how do you help out Elevate, and what's your role in helping them out?
So, great question. So, my wife is a master trainer. I'm also a strength and conditioning specialist, and we go to 2 different gyms in the area where we network and we know a lot of people. And I refer everybody that may need the services of Elevate, obviously to Elevate. And obviously the patients I see at Family Medical. I'm a networker, so I tend to meet a lot of people, and I can decipher who's ready, somebody who could benefit from the services of Elevate.
Will was telling me something about that you guys are helping out people that don't have insurance and to get the COVID test. Tell me a little bit about that.
So Family Medical Clinic is doing COVID testing, free for the uninsured, and if you have insurance, we accept that as well. So we put it under a program that Florida has called the CARES Act. So everyone that comes in has the opportunity to get tested. So wherever you are, you could get tested as many times as you like.
Wow,
symptoms or no symptoms. So you can be asymptomatic and come get tested.
How do they set up an appointment? Do they just call?
They can call, email. We have a call center that I hired that is handling a large call volume. We get a really big amount of calls, so they handle that. Not a factory. We actually sit down and care about the patients. We explain to them one-to-one what's going on internally, externally, what's going to be the benefits, and we just treat them like family.
And how are you doing the same thing? Are you servicing customers or patients when they're sick through the internet as well, or how does that work?
Yes, we do actually provide telemedicine in both Elevate Miami and FMC. We do telemedicine for health clinic purposes. If you're sick, urgent care, we can treat you depending on your symptoms. We call you, it's a face-to-face call, and we can send your prescription depending on what you have, whatever diagnosis that you're set with. And same thing for Elevate Miami. We're now rolling out a program where we can actually see you, you go get your labs, and you can have a Zoom call with our provider. And she goes, hey, your hormone levels need to be optimized, and therefore.
Wow.
Yeah.
That's awesome.
Yeah.
That's awesome.
It's really great.
How long does that process take to like get somebody set up, do all their lab work or whatever, somebody really wants to come, use, let's say, Elevate. How long does that process take? And how do you, like the new customers that come in for, let's say, your business itself, how do how do they come in? Are they coming in like with a referral, or are you like the primary care? How does that?
Yeah.
I want to like clarify it, because if I'm not sure, the people listening aren't going to be sure. So that way we could figure out how does that work, if you need a referral or not.
So you come in through the family medical clinic portion of it, and we become your primary care physician.
Okay.
We'll do an annual on you. We'll go ahead and do your labs, your EKG, make sure you're functioning where you should be.
Right.
And your lab work takes anywhere between 48 to 72 hours to come back. So from that point on, when the labs come back, then if they want to be in the HRT program, if they qualify, and if they're fit and they're interested in optimizing their levels, then they cross over to the Elevate side.
Walk over here with me.
You want to go meet?
And get an IV. And while you get your IV, you can watch your favorite old movie. You can get teeth whitening at the same time. And yeah, here's when you come. IV therapy.
Let me check out these things. Oh, hold on a second.
Yeah, so IV nutrition is
Hold on.
a way to supplement the blood with direct nutrition into the bloodstream. So I'm going to do you hydrate with saline, but we'll put absorbic acid, magnesium, all the good stuff. We'll put it right directly into your bloodstream. 30 minutes of time. You come in, you watch whatever show you want to watch on our TV, and
So if you go out, have a crazy weekend, call Elevate, right?
that's one of the things. It's kind of like a hangover package, but we've seen a lot now that people are actually just doing it for well-being. One of the things that they say, they're saying, is high levels of vitamin C in your bloodstream can fight off any virus. Across seas, a lot of people are overdosing vitamin C to kill these viruses. So you can get an IV with absorbic acid, which is vitamin C, okay, directly into your bloodstream. A lot of our bodybuilding clients, we have affiliations with certain gyms. They come in because obviously you know that they're working out a lot. They're pumping a lot, they're sweating a lot, so they come in, they hydrate with IVs on a weekly basis.
Wow.
Okay? So that's a... Okay, so this is our aesthetics room. We basically do Botox and we do therapy in here. We actually do body contouring. We have belly shape from Candela. So basically what that does is a cellulite reduction and body contouring. So girls come in, they want a nice, more defined abs or legs, or we do back of arms, we do chin. So you come in for a session here, and our massage therapist works it into...
That's awesome. I don't know, machine looks high-tech to me. I don't know.
Yeah.
That is cool.
Belly shape from Candela, they're industry leaders in that field.
Bro, that looks cool. This is a really nice spot. Like, you guys have everything like really nice, clean. It's not like if I were going to like a medical clinic, bro. Like you go to medical clinics and you're like, oh, where am I? I'm like in a movie, a horror movie or something. Here we feel so like at ease. It's awesome.
Down to the smell. We actually hired a company to come in and we do aromatherapy throughout the air, through the AC. So I don't know if you smelled it, maybe it was not with the mask.
No, I can smell. You know, I got a big nose. I smell it all, bro. There's just a lot of information that I didn't have no idea that you could have this as your primary care, and and that you could.
It's kind of like a one-stop, like you said, one-stop shop.
Yeah,
we come in
one-stop
as
shop.
general medicine, we check you out, and if you want those needs, some people want that, so you can provide that
Do you
service.
what insurances are you taking at the moment? Or the basic ones, or
We take most commercial insurances. We take United Healthcare, Cigna, Blue Cross Blue Shield, Multiplan. We now just got enrolled in an Obamacare plan, which is called Oscar, which is brand new and Bright Insurance. And AFMED and Aetna is now in the works as well. So we pretty much
so
are
you're
pretty much
covering all
everything.
bases, yeah. That's awesome. That's
Yeah.
awesome. Well, I want to thank you so
Thank
much
you.
for
Thank you
your
for your
time.
time.
Thank you, and
welcome.
you guys are doing an amazing job, for real. And thank you.
Thank you.
You know, you guys are the
Goosebumps.
best. Thank you. I know, but
Should we do the
listen,
album?
you don't catch anything by touching
Yeah.
somebody.
Yeah.
Yeah, no, it's like now they're saying that if you wear this, you're gonna catch it if you
Yeah.
wear your mask too long. So
Yeah.
CDC get it right.
Yeah. So.